Okay, so now we're going to have a quick go through laminitis specifically, in looking at laminitis in light of coronavirus and our current restrictions. So laminitis basically is the inflammation and weakening of the soft tissues that hold the bones in place in the hoof. So we're looking at this area, and of course it goes all the way around the wall of the hoof. It's not just at the front. The bones of the hoof come down here, and when these get inflamed, they get weak and they break, and that means that these bones here can go down in this direction or spin round like that, so that they point towards the sole of the foot rather than staying in line. Both of those changes are quite severe, or very severe, and they are much harder to manage once those changes have taken place. So our emergency management in a laminitis case is focused on trying to support these bones here by putting support under here, so that we take the pressure off these damaged laminae for as long as we need to, for them to repair. So laminitis has many different causes. Most of them are involved in most cases, just to varying degrees. So chronic obesity is a real biggie. Then we have things like too much grain, too much grass, frosty grass if they're ill, so if they have had a fall and then they retain their cleansing, or they have a colitis. Their feet being overgrown. Then we have metabolic diseases like PPID and EMS, which is all related to your chronic obesity and age. So chronic obesity, age, long toes, PPID, EMS, those tend to be probably the biggest key factors. So what are we looking for when we're looking for a laminitic? What sort of signs might make you think when you're talking to your vet that your horse has laminitis? Well, there's the classic stance, which is when they're standing with their weight rocked backwards, so they're trying to put the weight onto their heels. Most cases of laminitis are worse in the front feet than the hind feet, because the front feet carry more weight and it's a weight-related disease. So in the front, so you see them sitting back because they're trying to put the weight onto their heels. Not all laminitis present like this though. These are more severe usually, these ones. Very mild laminitis or early laminitis, which is when you want to catch them, can look just a bit stiff walking, so a bit stilted, not quite as free and easy and comfortable, a bit footy. If you walk them on a concrete or on a hard piece of ground, a hard dry piece of ground, and turn them in a tight circle, sometimes they'll stop halfway around the circle and they'll noticeably put their weight back. They may keep walking around, but they sort of potter around the corner rather than walking smoothly around it. They may have hot feet, and the digital pulses, which are run down the back of the leg, round either in the fetlock or the pastern. You can normally feel them. In some horses, in some individuals, they're really hard to feel. In some, they are easier to feel. So if they're really big and thumping, then that means there is inflammation in the foot. It doesn't mean it's definitely laminitis. It could also be pus in the foot, but a big thumping pulse to the foot means that you've got inflammation in your foot, and that is painful. You may have trouble picking up your horse's feet, so if your horse is normally well behaved to stand on concrete, have its feet picked out, and it's starting to try and put its foot down early, or it's fidgeting, it may be that its other feet are hurting. So you picking up one foot and it having to put its weight onto a lot of weight onto the other front foot or hind foot makes that foot painful. So they don't like having their feet picked up to pick them out. They may also present as just lying down for long periods of time. You may notice that your horse is lying down more in the field and is reluctant to get up when you go over. Sometimes we get called out for a colic when actually it's laminitis. These are all important things to tell your vet. So causes, in older horses, we've got things like Cushing's, metabolic syndrome, obesity in itself, long feet. As you can see, the lists are pretty similar. You're less likely to have Cushing's as a problem in a younger horse, so it has been reported in horses as young as 12 years or younger, but it's less likely. Metabolic syndrome and obesity are obviously two biggies. Long feet, that sort of thing, all can play a part in it. So as we can see, you can go from a stage of having no laminitis to laminitis, but there's a gap in the middle. It doesn't just happen overnight. It tends to be something that develops. So Cushing's, excess weight, metabolic syndrome, they'll all take your horse from a completely normal state where you've got no very low risk of laminitis up to sitting in a more risky state. You know, you are generally closer to having an active case of laminitis. This excess weight might have been sitting there for years. And classic is when you have a, I don't know, 7 or 8 year old horse that goes down with laminitis, and we get told that they're not fat, they've always been that weight. Well, that weight has caused a state of chronic inflammation over many years, and you're seeing the consequences of it at that point in time. So excess weight, Cushing's and metabolic syndrome, all those underlying things will increase your horse's likelihood to develop laminitis. Long toes may be the bit that pushes you over the edge, or maybe a bit of stress, a bit too much food, hard ground. Those things are smaller. They may just be the straw that breaks the camel's back and pushes you into laminitis, or it may just be that this yellow bar grows longer and you end up with laminitis. Either way, these are all things to consider and mention to your vet when you talk to them. How can you prevent laminitis? So weight control. 40% of horses in a clinical study were found to be obese, and even more of that were just overweight. And in another recent study, only 35% of owners recognise that their horse is overweight or obese. So if you look at the horses out there, the vast majority of them are going to be obese or overweight. So what your friend's horse looks like may not be a good indication of a normal or a healthy body condition score. Best thing to do, body condition score your horse weekly, not daily, because you tend to miss little changes. If you do it weekly, record it so that you can look back and look at trends, whether it's going up or down. So you can body condition score or fat score, or you can use a very high-tech personalized weight monitor, which is a long piece of string that you put around the horse. I would normally clip off a little bit at the withers and under the belly, so that you always put the piece of string in the same place. Pull it to a certain tightness, mark the string. That string must not get any longer. You can do another bit around the neck, because the crest is also a very important area of fat deposition. So if you do one for the girth area and one around the neck, and make sure those get smaller if your horse is obese or overweight to start with. So looking here, we have fat up here. These are obviously two very fat horses. Got a big fat cresty neck. We've got a pile of fat here behind the shoulder. Got some love handles developing here. Got fat pads above the eyes and at the tail head. So those are the classic places to get them. So that's the areas that you need to concentrate on. The bit you can't see, which is just as dangerous, is the intra-abdominal fat, because that will be producing inflammatory products which put your horse into a state of chronic inflammation, and those increase the horse's likelihood to get active laminitis. So if your horse has laminitis, it's doing that stilted walk around the corner, or it's rocking back on its heels a bit, or it's just lying down more, or it's reluctant to pick its feet up to have them picked out. If you've got stabling nearby, and it is nearby, and you can just move your horse very slowly to it, do. If your stabling is not nearby, or it's the other side of a far field, and your horse is really sore, you may need to build a stable in a field. You can do this by putting electric fence posts out, just containing your horse using electric fencing. I wouldn't put it on if you're only doing a small space, and then filling the space with shavings so that the shavings support the sole of the hoof and most importantly under the frog. If you manage to get your horse into a stable, you need a very thick bed right up to the door. Shavings is best. And don't turn your horse out. Call your vet and discuss the situation. They'll let you know whether they feel you need a call as an emergency, or whether they feel you can do a video call, and they can prescribe bute. We've had changes in our regulation, so that now we can prescribe drugs via video call during this pandemic. Don't give bute unless you've spoken to your vet, so we can see exactly how sore they are. How do we prevent laminitis? Exercise reduces insulin levels and reduces the risk of laminitis. It's hard. It's hard at the moment because there's no competition, and we don't want to increase the pressure on the NHS by falling off our horses and ending up in A&E. So you do need to be a little bit realistic about this. Exercise is really good, but if your horse hasn't been ridden for 3 weeks, maybe lunge it first, or lunge your horse, put them on the walker, do that sort of thing. If you can keep your horse's feet trimmed, it's a good idea too. They don't need to stay shod necessarily, but we do need to try and make sure their toes don't get too long. Blood testing. This can be really useful to help manage some cases. You're looking for insulin, cortisol, adiponectin, ACTH, but it may not be essential in every case. It's unlikely to be essential in every case. So this is something that you need to discuss with your vet, how it's going to happen, whether it needs to happen at this particular point in time. And this is something that is going to be different probably with every case the vet sees, and will need to be managed on and discussed on a case-to-case basis. As with all of these things, whilst we're in this pandemic, we need to be really careful to try and look after our vets, look after each other, and remember our vets have families and colleagues that they don't want to pass anything on to. So if you have any active signs of the infection of coronavirus, or if you are in a household where there is coronavirus, please do not attend the call with your vet. Ask a friend to do it and talk to the vet on the phone. We want everyone to stay safe. So laminitis will get worse if you move the horse when they're painful. Okay, it will also get worse if you move the horse if their pain levels have gone down a bit but their laminae aren't strong enough. So you must rest them. That's why if you can't get your horse to a close stable, sometimes you need to consider going a bit radical and building a padded stable area in a field. Rest is best. You need thick bedding all the way up to the door, anywhere the horse might stand to support the feet. Shavings are good, they pack in. Sand is also good if you can use a corner of a menage. Soak your hay, that will take the sugar out, it will keep your horse's guts moving, help stop stereotypies, and keep your horse happier. But you do need to soak it for 16 hours or so. This will take some protein out and some vitamins and minerals which they need to mend, so you need to replace those with a balancer. Please don't give bute until you've discussed with a vet. And as always with these, phone your vet first and discuss whether or not you need a visit and how you're going to carry out that visit in these times.